If you are living with kidney disease, pause. This matters. Why it works. Instant signal relevance. Calm, not alarmist. Invites attention without fear. Sounds different from typical medical content. Like I've always said, this is not a medical advice. It is a lived experience. I am a CKD end stage, or what they call end stage renal disease. I am on dialysis. And so what I am sharing is my own experience living and surviving on dialysis. Let's talk about kidney disease. This is for anyone living with kidney disease or loving someone who is. Even if you have not got kidney failure or kidney disease, you may know somebody who has. This is important. What you are about to hear isn't fear. It's lived kidney experience. Life expectancy in CKD and dialysis. Well, when I was first diagnosed for CKD and eventually put on dialysis, that was the first thing I went to check. Online. Because for me, it was a life sentence. Yes, we all have death sentences. We all will die, irrespective of your health situation, even without being sick, people die. So we all have death sentences. But when I was diagnosed for CKD and eventually on dialysis, I knew it was a life sentence and I knew it's in my own hand. But however, I went and did some Google search. The question I was asking was, how long can I live on dialysis? This is a calm, honest guide for patients and family. Almost every kidney patient searches this question, often in silence. How long can I live with kidney disease? And sadly, the internet often answers with fear, averages, and worst case scenario. Okay, let's reset the conversation with clarity and not panic. First, the truth without sugarcoating. Kidney disease does not come with an expiry date. There is no single number that decides lifespan. There is no fixed timeline attached to CKD stages. There is no universal outcome for people on dialysis. Life expectancy is influenced far more by how the disease is managed than by the diagnosis itself. So, if you are diagnosed for CKD, it doesn't mean your life is going to end at all. It only determines or depends on how you manage your life from that moment on. Just look at me. I go about my normal life. I just adjusted my lifestyle to coincide with living on dialysis. I still work. I still do sports. I still lecture. In fact, my everyday life continues. But yes, there are pains, there are struggles, there are times, there are hospital visits that comes along with living with dialysis. What really affects life expectancy in CKD and dialysis? That's the question I want to answer. Yes, what actually matters? day to day, year to year. One, blood pressure control. This is huge. Whether your kidney failure is as a result of hypertension or high blood pressure or diabetes, which are the two common causes, and in some cases, inherent genetically, you are born with it. It comes with high blood pressure. Kidney or CKD patients or people on dialysis usually suffer high blood pressure. I mean, is it the fistula in your arms, or is it the one on your neck, or is it the one on your lap? Wherever it may be in your body, it's always moving, it's always working. So the tendency for your blood pressure to go higher than usual is there. So poorly controlled BP accelerates. It accelerates your heart damage, it accelerates your stroke risk, it accelerates your further kidney decline. So stable, well-managed blood control protects both the heart and the brain, the two organs that most determine long-term survival. Two, diabetes management, if present, and even if not. Like I said, the two major causes of kidney failure is high blood pressure and diabetes. So it's not just having diabetes. It's how tightly and safely it is controlled. Glucose swings damage blood vessels. Consistent control slows complication. Many patients live long because they learn to manage trends, not chase numbers. So even if you have diabetes and you don't have kidney failure, you can live long. All you need to do is control your blood sugar. Then, third, heart health. As you know, the kidney, the heart, and the liver, these three organs work together. And damage to one can lead to the other if not controlled or curtailed. So most kidney patients don't die from kidney failure itself. Note this. I repeat, most kidney patients don't die from kidney failure itself, but from cardiovascular issues. What improves outcomes include: one, managing fluid balance; two, avoid chronic overload; and three, pacing activity and rest. I learned this the hard way. For the first 20 months of being on dialysis, I was constantly battling with overweight. In fact, I started dialysis 3 times a week. I felt better. I didn't know that. Nobody told me about that, but I was just doing it. So I didn't know that the dialysis was actually taking away fluid from me and keeping me balanced. My weight used to be in fact, before I started dialysis, I was about 140 kilo. And then after I became a CKD patient, I didn't know I was taking diuretics. I just know I was taking some medication. And then I started losing weight. I didn't know the fluids were really going out. So I dropped to about 110. And at 110, I continued to live. I was not even taking the diuretics again. And that was when I slipped into dialysis, not knowing that the overweight, or what we call fluid overload, was responsible for my high blood pressure. And my high blood pressure was responsible for my kidney failure. So, after 20 months, I keep going to the dialysis center, and each day, in between sessions, I have gained 5 kilos, 6 kilos, and they will take fluid, 4 liters, 5 liters. And I will see. So I was asking myself, why? What am I doing? And I found out that I need to manage fluid. I need to reduce water I take. Yes, if your health is normal, drink more water is allowed. But if you are on dialysis or kidney failure, reduce. Make sure if you are lucky to still be on urine, fine. Make sure your liquid, your fluid, which include the one you drink, when you take your medication, when you eat, and the one you use to cook, is managed effectively and not beyond your urine output. So I started measuring my urine output. My urine output was about 500 to 700 ml, so I was drinking 800 to 1 liter. 800 ml to 1 liter. And that was how I was able to balance. And from taking 5 liters, and I still am overweight, now they take 3 liters, 3.5, 2.5, and I am very close to my dry weight. So you need to avoid this chronic overload, or else you will continue to have problem. And another important thing is catch symptoms early. Know your body, understand your body. And that was one thing that saved my life. Because the symptoms of kidney failure are similar to other diseases. And in fact, that was where my problem started from. Because I have constant headache, I have back pains, I never sick. I never really get sick. But I have all these minor symptoms, which I assume it was stress, because I travel a lot, I work hard a lot, I do so many things, I do sports. So sometimes when I have this headache, or when I have this sleepless night, I attribute it to my daily lifestyle. I didn't know that my kidney was already screaming. Was screaming. So protect the heart and protect longevity. As long as your heart is still healthy and alive, you will live long, irrespective of CKD or dialysis. Fourth is your diet and lifestyle. Not perfection, but consistency. When they talk about diet, to be honest with you, I used to eat not a lot. People think a lot, not a lot. But the problem I have is I eat sparingly. Sometimes I skip breakfast. I barely had lunch. Then I will now have loaded dinner. In fact, I eat very late at night. I didn't know this was putting stress on my kidney. Because my kidney, the time the kidney needs to filter waste gradually, it now have to do all the work at the same time. And mostly at night when I'm supposed to be sleeping. And this became an habit. So if you are out there believing that yes, you are strong, you are healthy, you can eat anytime at 2 a.m., 12 p.m., 12 a.m., you wake up to go to the kitchen and eat, watch it. You are stressing your kidney. So, no diet is magic. What helps is sodium awareness, sensible fluid timing, adequate, not excessive, adequate protein, avoiding repeated extremes. Some people like certain kind of food. Like me, for example, I like swallow. So I don't mind to take swallow 2 times a day, 3 times a day. No. So nowadays, I take swallow maybe once or twice a week. So you have to eat certain food you must check your potassium level, your calcium level, your magnesium level, basically your electrolytes, your sodium level, your chlorine level, your chloride level in your meals. And don't overload, because if you overload one particular nutrient, then there will be nutrient imbalance. And the process becomes difficult for your kidney to filter. Small daily habits compound over years. And that was my problem. No doctor will perform that magic for you. Know your body and know what goes inside your body. That's what dieting is all about. Today, I've learned it the hard way. I don't skip breakfast. I take lunch when I'm supposed to do, and I take light dinner and eat early. No late night food. This way, you can live successfully on CKD and on dialysis and prolong your life without any sickness. Number 5, consistency of care. Patients who do better long term usually attend sections regularly, understand their labs, ask questions, adjust early instead of reacting late. Let me explain this. It's another experience I got. Because of my job, I have to alternate between working. In fact, I was working full time when I started dialysis. And that affected my session. Sometimes I skip sessions. I go when it's convenient for me, and it became irregular. What happens? I didn't know that in between sessions, I'm building up more toxin, and it's becoming difficult for my kidney to filter. And I was not really getting okay. I was more, every time I was breaking down. Secondly, I was reading my labs. I was getting every 2 weeks, every month, every 3 months. I was doing tests. I was checking them. I didn't really even understand. I just check and compare the values. And of course, your doctors or health practitioners may not explain. They just study it and give it to you. They use it for themselves to treat you. But you know your body. You know how to work on it. So you ask questions. So I started asking questions because I was taking some medication especially when I was taking EPO, the ESA, erythropoietin is the medicine that we kidney patients usually take because our kidney cannot generate red blood cell on its own. So in order to enhance the hemoglobin, so then they give it to me in my stomach or they put it in my bloodline during dialysis. So I was taking this, and this thing was expensive. One dose is about $35-40. And I asked myself, I was wondering why, because each time I take my hemoglobin, there is no increase. And I was asking, why am I taking that injection? So I stopped on my own. I didn't know that I was worsening it until my red blood cell or my hemoglobin dropped. So I started asking questions, and then I started getting explanation. So this is why you need to adjust early instead of reacting react. So I noticed my body, I see my body. When I started having pains on my bones, I cannot walk, I asked questions. They now told me, go and do a PTH test. The thyroid hormones. So I went to do the test, and I found out that it was so high. And because it was high, my calcium was low. And because my calcium was low, it affected my bone marrows. And don't forget that the creatinine is from the bones. That creatine gets into the bloodstream that now increase because your kidney is not filtering the waste, the toxin, and it's allowing them to leak into the blood. And that is why proteinuria is when you have protein in your urine and your urine becomes foamy. So all these things are signs. You need to see and react to it and ask questions. Engaged patients live longer, not because they are lucky, but because they are informed. The moment I started getting informed, I feel more better. I feel more healthy. In fact, life became more meaningful to me. Because on the onset, when I was first diagnosed for kidney failure, I was scared. I thought it's the end of my life. Like I said, I thought it was a life sentence. But when I started understanding the purpose of dialysis, the purpose of EPO, the purpose of iron, the purpose of balancing my potassium intake, the purpose of balancing my sodium intake, then I start to live very well. and comfortable. And that takes me to the number 6. Number 6 is your mental strength and emotional health. This is very important. This part is rarely mentioned and deeply underestimated. Patients who stay hopeful but realistic, who adopt instead of insisting on reality, the patients who maintain purpose, routine, and meaning often outlive grim predictions. They often outlive grim predictions. Distress hormones, depression, and fear do affect the body. I can tell you, my first 6 months on dialysis was stressful. It was the mental sickness, emotional sickness that was even more than the pains of the fistula, the pains of the needle, the pains of the blood recycling in my body. I thought about so many things. Will I die? When will I die? Is it time for me to die? Oh, why me? Why this sickness? What caused it? So many things was flashing in my mind. But as time goes on, I was able to overcome the mental battle and become mentally strengthened. And I thank God for the family support, friends, the church, because the biggest problem is if you have no money. It was very expensive. Very expensive. The lifestyle I start to live. I mean, you know what it costs for dialysis? Medications. But thank God I was able to get support from my family, from my friends, from the church of Jesus Christ of Latter-day Saints. And that really helped me, gave me hope, gave me another kind of purpose and why I needed to live and overcome my health predicament. If you have watched this video up to this stage, do me a favor, like, drop a comment, share this video. It may be touching somebody, if not you directly. You may know somebody who is going through this emotionally, physically, and otherwise. This video might just be a guide to that person getting his or her life back. So please just hit the subscription button, the red button below, and hit the button so that when I post any video, you will be the first to see it. Thank you.
Oh, let the water flow, let the spirit rise. I see the strength reflected in my... I'm rising up, I'm taking my stand, holding my life in the palm of my hand. Living, not just surviving. Living, yeah. Keep living, don't just survive, keep dreaming. You're still alive. From the clinic chair to the open street, keep the rhythm of the...
This video is based on my personal experience of living and surviving on dialysis. It is shared.
Ken Gaddafi is living with dialysis, not defined by it. Through renal timing, he shares his real-life experience to help others move from surviving to living. If you're inspired and would like to support his journey toward recovery and continued education, please consider donating to his GoFundMe campaign. Help save Ken Gaddafi. Scan the QR code to donate. Thank you for your kindness, support, and belief.
Oh, let the water flow, let the spirit rise. I see the strength reflected in my...